Good morning to all. I'm Dr. Velviri, Associate Professor, Department of Pharmacology, Sri Lakshminarayan Institute of Medical Sciences. So in this video, I'm going to discuss you about ocular pharmacology. So what is ocular pharmacology? Ocular pharmacology means what are the drugs which has been used for eye conditions. So why we have to use drugs for eye condition? Mainly to treat infection, to reduce inflammation, and to reduce intraocular pressures. Okay, so common eye conditions are mainly because of this condition. So what are the drugs which has been used for this condition we'll be discussing in this video. Okay, so before going to the drugs, okay, what are the factors which will influence us the drug effect? The first one is drug concentration. Yeah, always higher the drug concentration will be having the higher penetration. And viscosity. So by adding an methylcellulose polyvinyl alcohol will increases the contact time of the drug with the cornea, increases the drug action. And lipid solubility, always this is an important factor. Highly lipid soluble drugs will be having a higher penetration. And by adding surfactants like benzalkonium and thimerosal, this also will alter the cell membrane of the cornea and causes drug. Will influence the drug effect. And pH, the normal pH is 7.4. If there is any alteration, there is much difference in this pH, then it will lead to reflex tearing. Okay, so what are the routes by which drugs can be administered to the eye? One is local route like topical, periocular, intraocular, and systemic, it might be oral or injection. Okay, so we'll see one by one. Okay, so topical, we can give the drug as either as a drop, ointment, gel, or contact lens. And periocular, we have subconjunctival injection, subtenon injection, peribulbar injection, and retrobulbar injection. And intraocular, we have intracameral and intravitreal injection. And for systemic, we have oral, intravenous, and intramuscular injections. Okay, so first we'll see about topical drug methods. Okay, topical drug method, as I told, most common thing is drops, gels, and ointment. Okay, so what is meant by drop? It's the simplest form and it is a more convenient form. It's mainly used for daytime purposes. Okay, and actually approximately 1 drop is equal to 50 microliter. So conjunctival sac capacity is 7 to 13 microliter. So more 1 drop is more sufficient. Okay, so no need to give 2 or 3 drops. Even a single drop of the drug, okay, eye drops is more sufficient to produce the effect. Okay, so example is ciprofloxacin eye drops. Okay, a lot of drugs or antibiotic eye drops are available. Okay, so what are the measures it'll take to increase the absorption? The first one is after administering the drops. Okay, first drop, you have at least, suppose if you are going to give two drug as an eye drop. So after instilling one drug, you have to at least wait for 5 to 10 minutes for next drug to install. Okay, and you always compress the lacrimal sac. Okay, just medial canthus you have to press after administration. Okay, to facilitate the drug absorption in the eye for more time. And you have to close the eyelids at least for 5 minutes after installations. Okay, so by doing this, you can increase the contact time of the drug. And the next one is ointment. So ointment, compared to drops, it will increases the contact time of the drug in the eye. Okay, but the main disadvantage is it will produce a sticking of the eye and there will be blurring visions. All those things will be there, but these are not permanent one. Okay, these are temporary one. After stopping the drug, all these effects will move off. Okay, example for ointment is Neosporin eye ointment. It's commonly used for most of the diseases. Okay, and the next one is gel. What is gel? And gel is also almost like ointment only. Okay, so gel and ointment will be stay in the eye for longer time when compared to drops. Okay, so what are the drugs which is available as gel is Jovirax for eye viral infection and chloramphenicol. Okay, so for this thing, suppose if you want to give gel, drops, and as well as ointment, so which one you have to give first is instill the solution first. Okay, drops. Okay, then ointment and then gel. But in between each, okay, each dosage form, you have to wait at least for 5 minutes. Okay, don't install all the thing. Okay, drops, ointment, gel, everything at the same time. Okay, at least 5 minutes break will be there for each formulations. Okay, and the next one is Ocusat. So this is mainly used for glaucoma. Okay, so what is the advantage of Ocusat is no need to suppose in case of gel ointment you have to repeat it. Okay, so drops and all you have to put at least 5 to 6 times a day. Okay, so Ocusat is not needed. You can insert inside the eye. It can remain in the eye at least a week. Okay, so for 7 days no need to put the drops again and again. But the main disadvantage is irritation. Okay, because of it is remaining in the eye, it will causes irritation in the eye. Most common Ocusat is pilocarpine Ocusat, which has been used for the treatment of glaucoma. Okay, The next one is contact lens. Okay, even contact lens also has been used for delivery of the drug. So what they will do is they will so nano diamonds are embedded at the contact lens. So it will be having the drugs. Okay, so when it reacts with the tear, it will release the drug into the eye. Okay, so that is the main thing. Example is timolol maleate. Okay, timolol again it is used for glaucoma. Okay, so these are the some example for topical. Okay, and we will be using topical anesthesia. Definitely for most of the eye surgery we will be going for topical anesthesia. So it will, what this will do is it will temporarily block the nerve conduction in cornea and conjunctiva. So most common local anesthetic has been used is tetracaine, lidocaine, bubocaine, and procaine. Okay, so even for eye examination, not only for the surgery, even for eye examination and like visual acuity testing, any burns, okay, foreign body removal, all those things also will be using for going for topical anesthesia. Okay, so after administering the drug or whatever, what are the things the patient should not do, or what are the what are the precautions will you give to the patient is advise patient not to rub the eye at least for 20 to 30 minutes. Definitely it's very, very important. Okay, and do not apply any eye pad during this time. Okay, and patient, you can advise the patient to wear for sunglasses, prescription glass, all those things. That is not thing. Okay, must not be used for long-term pain relief. Okay, so those local anesthetic drops should not be used for a long-term pain relief. It may be for immediate thing. Okay, okay. So advantages: no needle incision. Okay, no need to go for injection technique. Okay, injection you can instill the drops via drops. Okay, still the drug via drops itself. Okay, and there is no so because of no needle incision, there is no injury to the eyeball. Okay, disadvantages: the only thing is difficult to move. Okay, move the eyeball. Okay, movement will be a little bit restricted. Okay, and no adequate anesthesia. Okay, sometimes because you are instilling as a drop, no, so anesthetic effect will be comparatively less when you are giving a injection. Okay, injection will produce an adequate anesthetic effect, but whereas in case of drops it little bit reduced. Okay, so adverse effects, it may lead to corneal stinging, epithelial and endothelial toxicity, allergy, contact dermatitis, all those things. And the contraindication, if the patient is having nystagmus or uncooperative patients, okay, this is contraindicated. Okay, yeah. Coming to retrobulbar block. Okay, so what is the retrobulbar block? So it is blocking a third cranial nerve. So the site of injection is above the inferior orbital rim, midway between lateral canthus and temporal limbus. So this is the ideal site for retrobulbar block. Okay, so it will produces excellent akinesia. Okay, loss of movement. Okay, the voluntary movement of muscle will get reduced. Okay, okay. So quick onset of block as less. Okay, so what are the disadvantages? There will be complication. It is very more in this retrobulbar. So to avoid this complication, will be going for peribulbar injections. Okay, so again the local anesthetic uses lidocaine and bupropion. So what are the complications the patient may go for? It may injure the eyeball also. So retrobulbar hemorrhage, globe perforation, optic nerve contusion, oculocardiac reflex, and respiratory depression also occur by systemic absorption of the drugs. Okay, so to avoid the retrobulbar complication, we'll be going for peribulbar block. So what is peribulbar block? So to block extracorneally, okay, we'll be blocking the nerves. Okay, by here the peribulbar injection, the injection site is midway between temporal limbus and the lateral canthus. So infromedial to superior orbital notch. Okay, so advantages is it is compared to retrobulbar block, it will be having less complications. Okay, so what is the disadvantages? So more than one needle injection is needed and longer time of anesthesia. Okay, and even it also leads to chemosis. Okay, and the next one is subtenon block. So what is subtenon block is okay between the sclera and tenon capsule. Okay, it may give the injection will be given at 1 o'clock or 2 o'clock position from the corneal limbus. Okay, so this subtenon block is also required for any cataract surgery or vitreoretinal surgery, trabeculectomy, adult strabismus surgery, pan-retinal photocoagulation, and optic nerve sheath fenestration, and therapeutic delivery. For all this will be going for subtenon block. The more drug example for drug is triamcinolone acetate. Okay. Okay. So what is intraocular injection? So intraocular injection is inside the eyeball. Okay, it may be an anterior chamber or it may be in the vitreous. So intracameral is anterior chamber, administration of injection into the anterior chamber. So example is intracameral asterocorrin during cataract surgery, and he'll be giving intravitreal antibiotics in case of endophthalmitis, infection of the eye. Okay? And intravitreal steroid in case of macular edema, and intravitreal anti-VEGF for diabetic retinopathy. So these are the some of the drugs which has been given via intraocular injections. Okay, yeah. We'll move on to the common ocular drugs. So what all of the drugs will be used? Yeah, we'll be using for mydriatics, miotics, anti-glaucoma drugs, antibacterial, viral, fungal, anti-inflammatory drugs, even lubricants. Okay, so local anesthetics we have seen, and even some of the diagnostic drugs. So there are a lot of drugs, but in this slide I'll be discussing some of the common drugs which has been used. Okay, so we'll first move on to mydriatics. So what is mydriatics? Mydriatics means these are the drugs which will produce us the dilatation of the pupil. Okay, so why this dilatation is needed? Yeah, sometime if you want to go for a fundus examination, refractory error examination, we'll be going for mydriatics. Okay, any adhesion, okay, to prevent adhesion between iridocyclitis. For those conditions also we'll be using this mydriatics. Okay, so drugs is anticholinergic. The most common mydriatics which has been used is anticholinergic drugs. Among this, homatropin, cyclopentan, and tropicamide is the most commonly used drugs. Okay, so all these things are atropine derivatives. Okay, so indication is corneal ulcer, uveitis, iritis, and even for cycloplegic refraction testing, all those things will be using this. Okay, so what is the adverse effect associated with this? Definitely, it will produce blurring of vision, photophobia. So photophobia means difficult to see the sunlight. Okay, light. Okay, then precipitation of angle closure glaucoma. Okay, because this drug is contraindicated in glaucoma, we should not give this drug. Okay, and the most common drug is tropicamide. Okay, yeah. And next one is sympathomimetic. It is also one of the mydriatics. So sympathomimetic means adrenergic agonist. Okay, the most common drug is phenylephrine. 5% will be used. Okay, so along with mydriatic in preoperative cataract preparation or fundus examination, we can be used. But this drug is contraindicated in hypertensive patient because of this is an adrenergic agonist. It is contraindicated in hypertensive patient. Sometimes it may also precipitate hypertensive crisis. All those things. Okay, so these are the two group of mydriatic we have. One is anticholinergic and the second one is adrenergic agonist. Actually, the difference between these two is this adrenergic agonist will not cause any photophobic effect or loss of accommodation. All those things will not be seen in this adrenergic agonist. Whereas in case of anticholinergic drugs, all this photophagia, cycloplegic effect, okay, loss of accommodation, all those things will be seen in that. That is why it is called as active metastasis and passive metastasis. So this is the difference between anticholinergic and adrenergic agonist, which is causing mydriasis. Okay, and move on to the next group of drugs, that is miotics. So miotics is exactly the opposite, which means the drugs which produces constriction of the pupil. The most common thing is pilocarpine, which has been used to treat. So all these miotics are mainly used to treat glaucoma. Okay, this is a main cause. Okay, but it will precipitate a night blindness, stinging, broache. Okay, difficult to dilate, all those things. Okay, so we'll move on to anti-glaucoma drugs. So what does it mean by glaucoma? So glaucoma means increased intraocular pressure is called as glaucoma. So you have to this increased intraocular pressure is due to an obstruction in the aqueous humor. Okay, so either you have to facilitate the drainage or you have to decrease the secretion. So all these anti-glaucoma drugs may act by reducing the aqueous production or by facilitating the drainage. Okay, so we'll see one by one. So first one is beta blockers. Okay, so beta blocker acts by reducing the aqueous production itself. It will reduces the secretion itself. Okay, so advantages, there is no pupil change like what we had. Now, for other group of drugs, there will be pupil changes will be there. But in case of beta blocker, we don't have these things. Okay, there is no intraocular tension fluctuation, no headache, all those things. But side effect is it also produces stinging, burning sensation, allergy, bronchospasm, all those things. Okay, so among beta blocker, the most commonly used anti-glaucoma drug is timolol and betaxolol. Okay, and the next one is epinephrine. So what is epinephrine? So it's again a adrenergic drugs. It acts on both alpha as well as beta receptors. This epinephrine is also found to reduce the aqueous formation and it also increases the aqueous outflow. Both the thing will be there. Okay. Side effects, again, all these anti-glaucoma drugs will sometimes produces burning sensation, stinging sensation. Okay, because of this is an adrenergic agonist, definitely it will lead to hypertension. Okay, and even some of the drugs like difephrine is also an adrenergic agonist, alpha agonist, it's been used for glaucoma. And the next one is pilocarpine. We have discussed it already. It's a cholinergic drug, that is cholinergic agonist. Okay, so what it will do is it increases the tone of ciliary muscles. Okay, apart from that, it will causes the outflow of, that is, it will facilitate the drainage of aqueous humor. Okay, so it is rapid acting, but it is a short acting drug. So you have to repeat the drug. Okay, so disadvantages, there will be fluctuation in the intraocular tension and visual loss also there will be there. Not permanent. Okay, there will be decrease in vision. Okay, side effects, it leads to spasm of accommodation, brow pain, and GI disturbances. Okay, so apart from this, what are the other drugs which can given cholinergic drugs? Physostigmine has been given, Demicarium, ecothiopate, and isofluropate. Okay, so next one is apraclonidine. Apraclonidine is an alpha-2 drugs. Okay, so it acts on alpha-2 receptors and reduces the aqueous formations in alpha-2 agonist. Okay, so it reduces the aqueous formations. Okay, side effect is itching, dryness in mouth, follicular conjunctivitis, mydriatis. Okay, so this is mainly to reduce intraocular tension after laser trabeculoplasty. Okay, and another alpha-2 agonist is brimonidine, is also having the same effect. Okay, and the next group of drug which has been used for treatment of glaucoma is carbonic anhydrase inhibitor. The drug is acetazolamide. It's mainly inhibit the bicarbonate ion and reduces the aqueous formations. Okay, other drug in this group is dorzolamide. It has been given as drops. Okay, acetazolamide is a tablet. Okay, so side effect is paresthesia, anorexia, malaise, and GI irritation. And the next one is prostaglandin analogs, latanoprost. This can also be used for treatment of glaucoma. And other drugs like hypertonic agents like mannitol, glycerin, these are considered osmotic diuretics. It also reduces the intraocular pressure. Okay, this can also be used for glaucoma. Yeah. Next one is, what are the drugs used for glaucoma surgery? Okay, so the drugs are antifibroblastic. Okay, antifibroblastic agent, that is 5-fluorouracil and mitomycin C. Okay, so what this drug will do is it will inhibit the collagen and protein synthesis by interfering with DNA replication. And okay, the main side effect is it causes keratopathy and scleral ulcer, iritis, all those things. Okay, can be given as injection, subconjunctival injection, and mitomycin can be given as topical agents. Okay, yeah. Next group of drugs is antibiotics. Yeah, these antibiotics are mainly used to treat infection of the eye. It may be an conjunctivitis or scleral. Okay, or endophthalmitis, phenophthalmitis, whatever it may be. Okay, the infection, it may be a bacterial infection, fungal, viral infections. Okay, so we'll be using a group of antimicrobial agents. Okay, so antibiotics is mainly for treating bacterial infections. Okay, so these antibiotics can be used topically or orally or even intravenously or even intravitreously. Okay, so any form of this route can be used for this administration of antibiotics. Okay, so what are the antibiotics? As I told, these antibiotics are mainly used to treat the infections like conjunctivitis, corneal ulcer, hydrocyclitis, blepharitis, all those things. Okay, so we'll see one by one. Okay, the first group of drug is penicillin. We all know. So penicillin is mainly for gram-positive infections. Okay. Okay, so depending upon the duration of action, it can be used twice a day, thrice a day, based on the drug effect. Okay, so main adverse effect associated with this penicillin is hypersensitivity reactions. Example is amoxicillin, cloxacillin, penicillin G, all those things. Okay, and the next one is quinolone. Quinolone is mainly acting on gram-negative bacteria, but when move on to first generation, there will be gram-positive action also. Okay, so among this, ciprofloxacin, okay, ofloxacin, okay, all these drugs are available. Okay, pefloxacin, moxifloxacin, gatifloxacin, all these drugs are available. It has been administered topically or even parenteral route. Okay, so uses, it has been used to treat keratoconjunctivitis, corneal ulcer, blepharitis, okay, infectious endophthalmitis, all those things. The main adverse effects of this quinolones is it's actually contraindicated in children. It may leads to a lot of ligament injuries, okay, ligament tear, all those things, and causes photosensitivity is one of the important adverse effects. And then moving on to cephalosporins, most okay, one of the drug which is having broad spectrum activity. Okay, so first generation is mainly acting on gram positive, and second generation will be gram negative, and third, when move on to third and fourth, will be acting on gram negative and even anaerobes, all those things. Okay, so drugs are cefazolin, cefadroxil, cefproxen, cefoxitin, cefixime, and ceftazidime. Okay, so these are the some of the drugs which has been used as antibacterial agents from cephalosporin groups. So again, the same indication like endophthalmitis, bacterial corneal ulcer, all this. So based on the organism, what organism is producing the infection, we'll be choosing the antibiotics. Okay. Okay, next glycopeptide. Glycopeptide is vancomycin. This vancomycin is not preferred for common like conjunctivitis and all. So this is mainly used for fan ophthalmitis or endophthalmitis or pleural uveitis. For those conditions, we'll be using this vancomycin along with cephalosporin, gentamicin, and amikacin. So we'll be combining 2 or 3 antibiotics. Will be given always subconjunctival injection or intravitreal injection, or will be going for parenteral, not as a drops. Okay, in case of fan ophthalmitis and all, drops at all will not work. Okay, not give us any good result. So we'll be going for parenteral route. Okay, next chloramphenicol. So chloramphenicol is mainly for gram-positive organism, even gram-negative, aerobes, chlamydia, rickettsial, mycoplasmic infection. For this type of infection, we'll be going for chloramphenicol. We have ointment, injections, oral, everything. So mainly used for intraocular infections and conjunctivitis. So what is the side effects? The main side effect is it produces bone marrow depression and aplastic edema. So in case of children, we have to be very, very cautious. Not only children, even for adult also, it produces bone marrow depression and aplastic edema. Okay. And the next one is tetracycline. So tetracycline is mainly used for toxoplasmosis infection, chlamydial infection. For those, okay, flammatory conjunctivitis, for those type of infection, infection will be using tetracycline. So okay, what is the side effects? Definitely it will causes discoloration of teeth, photosensitivity, rashes, and nephrotoxicity. And the next one is aminoglycosides. Aminoglycosides is mainly preferred for gram-negative bacterial infections. Okay, most common drug is gentamicin. Okay, even amikacin will be either it may be in the form of drops or injection parenteral. Okay, uses mainly used for gram-negative eye infection like endophthalmitis. Okay, for congenital necrosis, all those things will be used. Okay, so other drugs in aminoglycoside is amikacin, tobramycin, and neomycin. Okay, so tobramycin is mainly preferred for protease and pseudomonas infections. Okay, next sulfonamides. So among sulfonamides, the topic drugs we have is sulfacetamide, sulfamethoxazole, and sulfacetamide. Okay, cotrimoxin is one of the drug which is available in a fixed dose combination of the drug. So this sulfonamide is the drug of choice for trachoma infections of eye. Okay. Okay, so these are the antibacterial agents which is used for bacterial infection of the eye. Okay, we have fungal agents. Okay, antifungal agents also, like mainly will be used for fungal infection of the eye, like amphotericin B. Okay, amphotericin B will be effective against yeast and filamentous fungus. And we have nystatin against candida, natamycin against candida aspergillosis. Okay, so all these things are used for mycotic corneal ulcer, that is fungal corneal ulcer, and fungal endophthalmitis or keratomycosis. Fungal infection of the eye will be going for antifungal infections. Okay, and some of the azoles we have. Okay, this like clotrimazole, miconazole, ketoconazole, all these things also been used as a topical agents. Okay, we have drops, okay, ointment, and even subconjunctival agent. Okay, we are here using. So this also used for fungal infection of the eye, like endophthalmitis, all those things. And among azoles, we have triazoles like fluconazole also has been used for cryptococcus infections. Okay, so all these things are available as oral, topical, as well as parenteral. Okay, so these are the picture which demonstrate the fungal infection of the eye. Okay, it's fungal characteristics. Next, move on to antiviral. So antiviral drugs are mainly used for viral infection of the eye. Okay, so what are the drugs we have is hydroxyuridine, maybe as drops or ointment, mainly used for viral ulcer of the eye. Okay, so dendritic ulcer, herpes simplex, keratoconjunctivitis. Okay, all those things. Okay, another drug is acyclovir. Acyclovir mainly used for herpes infection of the eye, and Epstein-Barr virus, cytomegalovirus. Okay, among this group we have valcyclovir, famciclovir, ganciclovir. Okay, so depending upon the duration of action, it may be preferred TDS or BD or water. Okay, so this is the picture demonstrating viral dendritic ulcer. Okay, this is cytomegalovirus retinitis. Okay, so we have seen about bacterial drugs, antibacterial, antifungal, antiviral. Okay, so allergic, yeah, definitely. By nowadays, allergy is the one of the important phenomena. Okay, even starting from the child till adult, all are suffering by this allergic reactions. Okay, so what are the drugs which has been given for this allergic reactions? Okay, main drug is will be going for antihistamine. Definitely, will be going for topical drops, antihistamine, and acetylactin. Okay, loratadine, all those things. Either we go for mast cell stabilizer. Okay, so these are the drugs which will inhibit the degranulation of the mast cell, like promoglycate, sodium promoglycate, olopatadine. So all these things are administered as a drops. Okay, even if it is severe, it can go for oral also. Okay, so which type of eye infections or eye allergic reactions they will be having is vernal keratoconjunctivitis, allergic keratoconjunctivitis, okay, papillary conjunctivitis. So mainly for allergic reaction of the eye will be going for this group of drugs, okay. And apart from this antihistamines and mast cell stabilizer, one of the important drugs which has been used to reduce the inflammation is corticosteroid, okay. Yeah, mainly used for reduce inflammation and even allergic reactions. Severe allergic reactions can be reduced with the help of steroids. Okay, so what are the steroids? We have topical steroids, oral steroid, and injection steroids. Okay, so topical steroid we have is prednisolone, hydrocortisone, betamethasone, and dexamethasone. So these are used for allergic keratoconjunctivitis and even for iritis, all those things. Okay, all these things are because of allergic condition only will be using, not for infective conditions. Okay, in case of infective conditions, if you go for steroid, it will again precipitate the infection. So in case of infection, you have to, before administering or before prescribing steroid, you have to make sure whether the patient is having infection or allergic reactions. Only for allergic reaction we can do this thing, but in case of infection, this is one of the drugs which should be avoided. Okay, next injection drugs, steroids we have triamcinolone and dexamethasone. Okay, and even for uses as endophthalmitis or again allergic, all those things, and macular edema to reduce inflammation will be using this group of drugs. And we have oral steroid too. So oral steroid are mainly used to reduce orbital inflammation, post-operative inflammation, and panuveitis, all those things. Okay, so and prolonged use, as I told, it may precipitate infection. That is the main thing, and it also precipitate cataract, glaucoma. So you have to be make sure. So steroid should not be prescribed for long-term use. Okay, yeah. So this is another drug which will reduces the inflammation, that is non-steroidal anti-inflammatory drug. The example is ketorolac and flurbiprofen. Okay, so what it will do is it will block the cyclooxygenase enzyme and reduces the inflammations. Okay, so these drugs are mainly used post-operatively to reduce pain and inflammation. Okay, after surgery, we'll be using these things. Okay, and even for a macular edema also will be using. Okay, allergic conjunctivitis, all those things. Okay, if the patient is having severe pain, we'll be using for these drugs. Side effects may cause stinging and burning sensation. This is one of the common side effects associated with all the eye drops. Okay, stinging and burning sensation will be there. Okay, okay. So another factor I told us anti-VEGF. Okay, so what it will do is it will inhibits vascular endothelial growth factor, that is VEGF. Okay, these drugs are mainly used for diabetic retinopathy and macular edema. For those conditions, we'll be using. Okay, so what are the drugs we'll be giving is pagatinib. Okay, ranibizumab. Okay, bevacizumab and verteporfin. Okay, so these are the anti-VEGF factors. Okay, so there are some drugs which has been used for dry eye. Okay, so what are the drugs? Okay, it's called as okay, these are used as tear plus like that. Okay, if the patient is having a reduced tear secretion, they will be having dry eyes, so difficult to see. Okay, they'll be having burning sensation, all those things. So what are the drugs which has been used to treat dry eye is hydroxypropyl methyl cellulose, polyvinyl alcohol, and carboxymethyl cellulose. So what these drugs will do? This will produce a soothing effect and act as a wetting agent. Okay, so this will not produce any epithelial toxicity, not cause any alteration in the pH. Okay, so it mimic like tears. Okay, that is called as mucomimetic. Okay, so it binds with the corneal epithelium and forms a layer. Okay, so this is the drugs. Okay. And we have viscoelastics. Example is sodium hyaluronate 3% to 1%, along with chondroitin sulfate and hydroxypropyl methyl cellulose. Okay, these are mainly used for surgeries. Okay, intraocular surgeries and for gonioscopic examination, we will be using this viscoelastic. Okay, so almost we have seen all the drugs. Okay, and for the treatment purpose, we have seen all the things. Okay, for diagnostic purpose. Okay, even we have some of the drug for diagnosing the eye diseases. The main one is fluorescent dye. It is available as drop as well as a strip form. Okay, so what it will do is, if you are touching the cornea, it will just stain the ulcer. If there is any abrasion, it will stain and it will. Okay, so mainly for diagnosing any corneal abrasion or ulcer, for applanation tonometry, detection of any wound leaking, and fluorescent angiography, for all those things will be using. But caution, it will stain. If suppose if the patient is using a contact lens, it will stain the lens too. So you have to remove it before diagnosis, before giving this drug. Okay, and fluorescent drops can also contaminate with Pseudomonas imperens. Sometimes it may precipitate Pseudomonas imperens. So all these things should be okay before administering drugs. You should take as a precautionary methods. Okay, yeah. And another dye is we have rose Bengal style. This also mainly used for severe dry eye and herpetic keratitis. Okay, so there are some drugs. We had seen all the drugs which are used for eye conditions or eye disease, but there are some drugs which will produce this eye toxicity. Okay, causes drug causing ocular toxicity. So what are those drugs? The first one is amiodarone, which causes keratopathy, and digoxin, which causes chromatopsia. Okay, what means they'll be seeing most of yellow colors. Okay, and chloroquine, it causes bull's eye maculopathy. Ethambutol causes, it also causes color vision disturbances, that is optic neuropathy. Corticosteroid definitely leads to cataract. Okay, and thioredoxin causes pigmentary retinopathy. Copper and gold causes lenticular opacities. Rifampicin causes anterior uveitis. Chlorpromazine will cause retinal pigmentation. Aminoglycosides will definitely lead to prolonged leads to optic neuritis. Sildenafil cause blue vision. Anti-muscarinic agents precipitate glaucoma. Vigabatrin and tamoxifen causes visual reconstruction, and alendronate causes conjunctivitis. Not only these drugs, we even have a lot of drugs, but I didn't mention all the drugs in this slide. But what are the most common drugs which has been used for the treatment of eye diseases and for a diagnostic purpose and even for toxic drugs? Everything, I think I have mentioned it clearly. Okay, so the most common thing is ocular drugs. Most common drugs we used is local anesthetic agents. Okay, we'll be using local anesthetic agents for surgeries or for eye examination, all those things, and the antibacterial agent for bacterial infection, antiviral agent for viral infection, and antifungal for fungal infections. Apart from this, we'll be using miotics and mydriatics, and we have anti-glaucoma drugs because glaucoma is one of the most common disease which nowadays it's becoming a more common, and you have to be treated immediately. If left it, definitely there will be going for complete blindness. Okay, so that is the another drugs, and we have a tear drops, tear substitution. Okay, all these drugs, just go through it. If you have any queries, you can put it on. Okay, these are my references. Thank you.